Okay, so what is TailoredTox? Well, it's not referring to Taylor Swift. It's actually our name for how we do our Botox, Dysport, and the like. And in this case, Jennifer, our lovely patient here, had some asymmetry of movement of her brows and had a little bit of a difficult time getting the perfect result elsewhere. And what we see is, raise your eyebrows for me if you could, Jennifer. She's a little stronger on the right side. So what we do is then we'll offset that a little bit. She notices that this side, when she has it, while the lines are better, it makes her feel, relax once for me. It makes her feel like soon afterwards, she's about 3 months after the last one. So there might be still some effect, but close your eyes gently for me. I'll gently hold the brows in a resting position. Now open your eyes. It makes her brow feel a little bit heavy, and more so on this left side than the right, as we saw in pictures earlier. And that's because she naturally holds this brow a little bit more strongly. And so if you put it in exactly the same place all the way across the forehead, then because this side still can move more, this one's going to be preferentially less mobile and more affected. And that's why she notices that skin excess and feeling of heaviness on that side. So what we have to do as a result, it doesn't impact at all what we do here and here. She's still going to get a great result there. But we have to tiptoe around how we do this area. We'll go a little bit higher up on this side with the treatment, and then a little bit, we can stay a little bit lower on this side, maybe an inch above the brow, in order to allow this one to still move enough that she doesn't feel that upper lid excess skin, which ultimately she might consider removing some of that. So if that's the case, then you don't feel the upper lid skin excess as much, of course, but and therefore won't feel as heavy. But in the meantime, the key thing is to adjust the placement of the neuromodulator, Botox or Dysport, a little bit higher on the side that naturally stays a little bit lower, or that's naturally a little bit weaker, and vice versa on the other side. We do it all the time, including for high-def TV news anchors and things like that. So it's very common and should be easy to fix. Okay?
Sounds great.
Thanks.